True. So there's a lot of mental stress and a lot of, would I say, emphasis that we need to put on mental wellness.
Yeah.
That has started as a country in Kenya just before COVID-19.
Yeah.
Because then we had the mental health bill, you know, we had gotten the task force was going across the country to get feedback and input into the same. So that had already started being in place. Now, when you talk about the mental wellness and as Kenyans also, we do not appreciate the seriousness of that mental wellness and the things that we need to do to take a break. Now, when you talk about partners, someone was talking about how we hardly spend time together. Yeah, it's only about
COVID-19 has forced people to spend time
so it's only about maybe 2 hours or 3 hours or something together, going to work together and together as two of us. Because then if it's meal times, their kids or the other family members, you know, but now this is
just the partners, just the
so
two
now
of you.
You're beginning to know each other like the truth of it. And then you've talked about pay cuts, you've talked about people who have lost their jobs. Then we have children home without even preparing ourselves. You can imagine during December how parents really talk about it and prepare. Like, I'll start shopping at the wholesale place. You know, what do I do with my kids for 2 years? I mean, 2 months. What do I? So now this is like
indefinite. We don't know how or when.
Now, for this particular one, this particular situation or crisis it's very unpredictable. We've never had COVID-19 before. I've never in my life faced such a situation. So there's a lot of uncertainty. We do not know, and then there's all this. So that your kids also see that. You know, they can sense it. You know, and no one seems to understand. And then by mid-April, we're supposed to have 10,000 cases. Then we are watching. You know, all these jokes of you actually even now get it and feel like you have COVID just from watching telly. You know, and all the updates. So that's also really stressful. Again, going back to us not appreciating mental wellness, so we do not even realize that we need it. We don't even realize, okay, with all this time at home, what do I need to do with my kids? Can we do some gardening? Do we get more time to, you know, together? Add the drama of homeschooling, you know, and just all the effort that comes with it, you know? So that also then is a challenge. And we do not also have, now they're getting into place, but we've not had like a serious response mechanism for mental wellness. And it's not just for the sick, that's also what we need to understand. It's, I am stressed. So how then am I able to call and someone is on the other line and maybe even toll free and even just listen? I can even share my fears. How then, for example, are those of us who are working, do we create time, for example, and spaces, even 5 minutes, 10 minutes, whether Zoom, whether, you know, we maintain physical, physical distancing, you know, and just discuss and just check in what exactly our fears. It's not business as normal. So you can, for example, come to work here at Ibru and just start off meetings like nothing has happened. There's that time that you need to check. Some of us are feeling so bad we can't see our parents. You know, we can't get out. So there's all this.
There's a lot.
There's a lot, and that's what is causing a lot of the pressure. So it's not just for the public. So my emphasis is for the public. It's also for those then that are violated. And actually, scared of getting violated and, you know, just that unsafe environment. But it's also for frontline workers. Healthcare workers are also really stressed. Really stressed. So it's for everyone else. And how then do we give each other space and how do we create those platforms just to be able to